Dr. K here, and welcome back to another knee pain exercise video series. And in this video, we're going to be talking about all kinds of fun stuff that you can do in your workout program. Forget exercising around the knee for right now. Let's talk about things that may or may not be safe, depending on where your pain is. Yesterday, we saw that there was a lot of interest in patellofemoral tracking issues, and the way your kneecap tracks in between your femur and your tibia, your upper leg bone and your lower leg bone. And really, there are grooves on your femur, on your upper leg bone, that allow your kneecap to track up and down. As you extend your leg straight out, your kneecap moves up, or should. As you bend your knee, it moves down. Now, I did hear somebody say, oh, well, my kneecap, it's tilted, and so I'm stuck this way. I went to therapy, I got some help, and it seemed to improve. One thing that you might not be understanding, and at least I hope was happening, is while you were in therapy, it sure sounds like they were actually working on helping it track better. It's not, oh, well, you're stuck. You see, there's a lot you can do to actually stop it from being tipped in one direction or another. Your kneecap can actually tilt superiorly, it can tilt inferiorly, it can tilt on any diagonal motion, and that can cause sort of bone-on-bone rub or friction to take place, and that's where the value of manual therapy comes in. And that's the kind of thing that I was expressing to you can be done when you go see a great physical therapist that can help you through this. They can work on actually assisting the glide of that kneecap up as you extend, down as you bend, and they can work on that directly with you. Now, that's not something I recommend you just start doing on your own, because if you don't know where your kneecap belongs in space, then you don't want to be moving it in the wrong place. I hope that makes sense. There was definitely a question out there about, all right, I get that you said toe out when you squat, but can you go over that point again? Yeah, absolutely. Okay, pretend these are my feet for a minute. We're just going to toe out symmetrically, slightly on both sides, and then squat. So we're going to stand feet about hip width apart or slightly wider, toe out just slightly. That creates what's called a bony block between actually your femoral condyle, the outside of your femur, of your upper leg bone, and where your patella moves now that you've toed out. That's just sort of like the bony arrangement that takes place as you externally rotate your hips. Toeing out is nothing more than that. It's turning your hips out, okay? Now when I go to squat down, it's going to stop my kneecap from being able to move too far to the side. See, when I'm toeing forward, there's a little bit of wiggle room, and it can slip over the place where it's supposed to track, cause repeated swelling, and a vicious cycle of inflammation that leads to you not feeling like you're capable of exercise. But by toeing out symmetrically on both sides, I'll show you. Now I'm toeing out, squat down and back, keeping my knees behind my toes, not letting them come forward, but butt back like that hover squat, and then stand up through the cheeks. Well, now I'm forcing my kneecap to track correctly, and thereby avoiding the problem before it can start. Okay? So when you're trying to squat safely, remember, this has to be pain-free. If this isn't pain-free, don't do it. Get the help of a professional. If it is pain-free, just by toeing out, now you can work on resistance training in that position, and then through a rehabilitative exercise, work on toeing forward again, slowly but surely, with a quarter squat, progressing all the way to full. And by quarter squat, what do I mean? Well, a quarter of the way down and back up. Eventually, in a day, a week, a month from now, I might be able to get to a third of a squat, then a half, and work from there. That's the magic behind rehabilitative strengthening. Starting partial range, strengthen what you can, in a resistive strengthening program for fat loss, strength and conditioning, all the different goals we're usually talking about. That's where you toe out, if pain-free, force the patella to track correctly, and then build some strength from there. Now let's talk about a huge value-added option that you can add to your workout programs. I consider unstable surfaces, once you're skillful enough to use them with other body parts, understand how a dyno disc feels under your hands or legs or feet, and you use it, it sort of creates this safety net over exercise, right? What's the reason for this? If I break form, if my knee slips too far forward when I squat, I lose my balance and step off of this. So I'm not saying squat heavy right now, okay? I'm saying get your form down. By being on an unstable surface, it corrects for form, if done correctly, and number two, or you lose your balance, and number two, it provides what's called co-contraction, stabilization around the joint. Grab all those muscles, have them grab onto that knee. Don't let your tibia or your lower leg bone fly forward or backwards or to the side, and make sure that you're in a stable environment when you exercise. That's the most important thing you can do. I want to make sure that when you're doing these exercises that you realize unstable surfaces can create a safety net around your exercise program. So when you're standing on dyno discs, I want you to squat down and back. You see how my feet sort of go back and forth? That ankle mobility aspect of what's happening is causing me to contract more on my quadriceps side, then more on my hamstring side, then more on my AB ductor, then more on my AD ductor. I'm constantly adjusting to keep me from sliding side to side, forward or backward on this unstable surface. Now what happens if I combine therapies, right, or combine exercises? Now I'm going to toe out slightly on these dyno discs, thereby providing myself a wider base of support and a greater amount of balance. I can squat down from there, stand through the cheeks, and stand right back up. Again, I'm providing myself with a more optimal environment to exercise and decreasing the resistance temporarily to allow a joint that's not moving correctly to re-educate itself, to learn how to properly recruit muscles in a position that's not abnormal and work from there. In the next example, we're going to talk about balance board squat. Same general principle, but we just want to make sure that we're adjusting for our weight shift side to side. What does this want to do if we constantly put more pressure in our left leg because our right knee is injured? It tips, or vice versa, right? But if we have to force our center of mass and center of balance, now we can learn to try and squat evenly side to side. And again, you're going to want to toe out. Now, let's take a look at the example of somebody that could have either lost a limb in an accident, okay, or somebody that really can't bear a whole lot of weight on one side, but they want to work on that single leg squat. Which, by the way, for the record, 100 of those bad boys? Are you kidding me? 100? You're crazy. You're obviously much tougher than I am, and that's awesome. So here's what we're going to do. Let's pretend our right leg's our good leg, and our left leg's our prosthetic leg, okay? Or, in this case, maybe an injured leg that can't take as much, but we really want to deliver a good workout to the right. We're going to put our left leg up on a ball, okay? Have something to grab onto so that you have something to hold onto and you're safe, at least till you get really used to this, and then squat down and back. What do we do by putting one leg on an unstable surface, whether it's a ball, a dyno disc, a balance board, or anything else? We don't bear weight on that side. It's obvious, right? You don't bear weight where you're not strong. You don't, because it's unstable and you would slip and fall. So all the weight goes to the other side. That's a really easy way of being able to shift, keep your body in the right position so that your leg doesn't shift to the middle and create all kinds of other hip and back problems, right? Because what happens when you balance better on one leg than the other? Your body moves your leg towards the middle so that you're almost walking on like a peg leg, right? And you don't want to end up doing that. You want to be able to walk in normal hip width stance, okay? Just the same as whether or not you were bearing weight evenly on both sides or not. The final thing I have to say about that is, what about the catching and clicking that can take place in your knee? Well, if it's your kneecap, the gentle gliding motions, non-weight bearing, kicking the leg straight out and back down, keeping your heel against the mat, laying on your back, and doing heel slides back and forth. That can assist in getting things going before you do the resistive exercise, instead of coming crashing down with your weight. The other option is, if it's not happening in your kneecap at all, what happens if there's like a stump of an ACL, an old injury, or you have a meniscal tear that's called a bucket handle, and it's getting caught right in between your femur and that like tibial plateau, your lower leg bone. Right as that femoral condyle comes down, it sort of rolls and it can catch on the meniscus if there's a tear there. That could be the issue. Easy repair, something you can get past, and sometimes something you can avoid surgery altogether and just deal with through the rehab perspective. So I'm Dr. K. I hope you'll visit me every single time at videofitnessblog.com, but that's not good enough, because I'm going to provide you with the best information out there when it comes to fitness and rehabilitation. I'm getting ready to launch a program that's going to completely knock your socks off, change the fitness industry forever. And the only way that this is going to be successful for everybody involved is if you tell, honestly, everybody you know. That's what I'm asking for. It's a big favor, but I give you a lot in return. So let's make sure that we work together here.